Hello, everyone. Dr. Christine Smith back for a really wonderful interview today with Dr. Bryce Appelbaum, who is a neuro-optometrist. And I love having him on because he has such a unique perspective on vision and helping us to understand all the different ways that we can work with our vision have had. And so I wanted to go ahead and bring him on to talk about this because it's just something that I think is highly beneficial for everybody to know and understand and know that it's even an option. And he even has a whole program designed to help people with their eye health. So hello, Dr. Appelbaum. Thank you so much for joining me. How are you?
I'm doing great. Good afternoon. Thanks so much for having me on here.
Absolutely. I was just telling everybody a little bit about you, and I'd love if you could share kind of how you fell in love with this, helping people to rehab their vision essentially. Like I think about how beneficial it is for not only everybody, but even especially people like athletes who really need to be able to make quick decisions and interpret vision. So yeah, I'd love if you could just share a little bit about you and your practice and how you fell in love with this.
Absolutely. So I'm a neuro-optometrist by profession, but really what it is functional medicine for vision. And my practice, my vision first, we've got offices outside of DC and Bethesda and Annapolis, Maryland. And really, I'm here so others don't have to struggle the way that I did. And I'm a product of the work that we now provide for people. To give you kind of the short version of this, when I was really young, I had significant visual developmental delays. So what that meant was I hadn't developed the ability yet to use my eyes together as a team, and I had poor depth perception and difficulty even engaging with space from a clarity standpoint. And went through a really long, rigorous process of office-based vision therapy, office-based sensory integration-based occupational therapy, and really attribute all my success in life, athletically, academically, even interpersonally, to what I developed, what was kind of given to me in a training setting. And if you think about every visual skill and ability out there, everyone that we all take for granted when it's working well, our tracking, our focusing, our depth perception, our teaming, no one's born with this. They come through our life experiences. We develop the ability to use our eyes together as a team. So that's something that's either learned well or not learned as well as it could be, and that's when some intervention is needed. So I'm just so grateful to be able to help others the way that I was helped when I was much younger.
Absolutely. Well, and I think, like in a really simple term, it's almost like physical therapy or training for your eyes. And just like we train everything else in our body, why would we not train one of our most important organs that literally is an extension of our brain? And I know you kind of like to define the difference between a neuro-optometrist and other eye professions. How would you tell people about that?
Yeah, so all eye doctors, we're all kind of trained very similarly in that we're trained on a reactive model to intervene when there's disease, and on this heavy pursuit of getting everybody to see the tiny letters, the 20/20 line at every distance. But that's just eyesight. And eyesight matters, and eye health matters, but vision is completely different. Vision is our brain and how our brain tells our eyes how to move and to focus and converge and track and process information, and how we derive meaning from the world around us and then direct the appropriate action. So vision is really how our brain is using our eyes and how it's processing that information. And yet most eye doctors are just getting you glasses, contacts, getting you to see the small letters. But at least in my private practice, the average patient we work with has seen 4.5 eye doctors looking for a solution before finding us. And I think that's more of a problem with just the medical world in general being much more reactive. We are much more proactive, and especially with screens and all the visual stress of life in the digital world we're all in, vision problems are everywhere, and people are going to learn pretty quickly how to spot these and what to do when you do find hidden, misdiagnosed, or just often interfering vision problems.
Yeah, let's dive right into that. Like, what do you think are some of the common misdiagnoses and especially missed opportunities because of a misdiagnosis in vision care?
So there's a few different areas. I think for children in particular, learning to read is something that we all take for granted. And, the 1 in 10 kids has a vision problem significant enough to impact learning. And vision being our dominant sensory system, over 80% of what we learn in the classroom comes from the visual processing of information. And so when children are asked to do things that they haven't developed the ability to support yet, or they don't have that foundation in place to be able to meet those demands, they develop symptoms. So with reading, that's skipping words, losing their place, having difficulty making things clear, decreased comprehension, looking like there's ants in their pants. You know, labels are so quick to be slapped on behaviors, and something like ADD, ADHD, dyslexia, in my opinion, are incomplete diagnoses unless hidden functional vision problems that cause the exact same problems, exact same symptoms are ruled out first. And as everyone knows, there's not a blood test that says, oh, yes, look, you have ADHD. It's based off of symptoms and behaviors. And about 2/3 of the classification symptoms in the DSM-4 are actually the same as for functional vision problems, yet this is all treatable. And there's pretty simple screening tests we can all do to see, is vision interfering? Is vision not allowing somebody to achieve at their potential, or is it where it needs to be? And at least that's a first step with very low risk and massive reward if we're able to address that ahead of time. So for children, I think that's one of the biggest. But that, you know, any adults, any age can obviously have struggles with reading and learning and engaging with near demands like screens. But then also even with head injuries. I mean, vision is represented in every lobe of our brain. There's more areas of our brain dedicated to processing vision than all of the other senses combined. So as you know so well, you can't have a head injury and not have your world be disrupted. It's just a matter of at what level. From a vision standpoint, that means there's sensory overload in crowded, busy areas like malls or grocery stores, or, you know, if you're the need to kind of retreat because you can't process all of that information, or engaging with screens can cause dizziness or nausea or even vertigo. These are functional vision problems. The brain is operating a different way than it's wired because 2/3 of our neurons enter our brain actually coming from our eyes. And vision therapy can be a missing piece to a head injury recovery, to return to learn, to return to life, to return to so many aspects of happiness that we all take for granted unless it's swept out from underneath us.
Absolutely. And I think you're one of the few vision doctors that I know that also kind of takes functional medicine into account. So, you know, let's say that you have a kiddo who fell at the playground and kind of bonked their head a little bit. Well, one of the things that we don't often talk about is that when we get a little head bonk, our body actually goes into an inflammatory state. We can get a little bit of leaky gut. And if you're feeding that kid a bowl of macaroni, a Sunny Delight, and a, you know, little bag of Skittles, they just ate like 167 different chemicals. And now all of a sudden it's affecting their gut and it's affecting their biology. And all of a sudden it can start to affect their vision because toxins are highly effective to our vision. And then you put glasses on this kid and label them with ADD, and they never get therapy to correct the vision. And then the muscles start to develop differently for the rest of their life. And nobody's addressing any of the chemical things that are leading to a hyperactive brain. So I would love, like, in that scenario, what's your opinion on that kind of thing?
First of all, preach on. This is fantastic, and more of the world needs to hear this. You know, neuroinflammation occurs with every head injury, minor or major. And if you can think about how our brains adapt to our environment. I mean, anytime we're presented with stress, we adapt or we avoid. And the vast majority of functional vision problems are maladaptations. They're bad habits because we're forcing ourselves to do things that are hard. So somebody that hits their head, the most common symptoms: blurry vision, headache, light sensitivity, eye strain. I mean, all the things that many people are like, wow, I have this and I didn't even hit my head. And these are all too common because the old school mindset was, you got your bell rung, you're fine. Or the opposite end, go sit in a dark room and you know, wait till things get better. But we need to be more proactive, and we need to tap into the different sensory systems to reestablish order. And you know, the mental health component, I love you addressed that. The amount of people I see, in particular women age 35 to like 60, who are told that they have PTSD or anxiety, or it's in their head because no doctor can diagnose the concussion. It's not like there's, again, the blood test. I mean, when you go to the ER with a head injury, they're going to run a CT scan or make sure there's no pooling of blood in the brain, which is important. But looking at brain activity with functional MRIs or SPECT scans, or having baselines that we can then identify changes from, those are diagnostic for yes, you're using your brain a different way than you were previously. And, from a vision standpoint, what often happens is the inside and outside muscles of the eyes stop working together in synergy. So, inside muscles, that's the focusing system, that's making something clear, keeping it clear, that lets us know what something is. Outside
Changing
muscles
the
is
shape of the lens.
absolutely, and the ability to look at a screen right now and have that muscle locked in to keep the screen clear. Outside muscles is eye coordination, eye pointing, and so most notably convergence, the ability to pull our eyes together for reading and screens. And so often with the head injury, there becomes this seesaw between these two systems where the brain's using them independently of each other, or there's a rivalry over which eye you're using, and they start to become in a fight. And that is the root cause of so many symptoms associated with head injury. But just like any muscle in our body, we stop using it, we lose voluntary control. We can train our brain. You mentioned vision therapy being like physical therapy. It's physical therapy for the brain through the eyes. But for some reason, people say, oh, no, you can't train eye muscles. You can't train the brain to have different communication with different centers. I mean, that makes no sense. But yet, that's what a lot of people preach. And with the right work, the right motivation, the right compliance, I mean, almost every concussion can get back to where they were, or at least to a better place with the right work.
Absolutely. And concussion is just one example, right? Like as we were saying, like the eyes are actually an extension of the brain. Like for anyone who didn't know, the whites of your eyes are actually an extension of the dura mater, which is the covering of your brain, which is why when you move your eye muscles, you can actually feel muscles at the back of your head move because it's all connected. So with this, like even with mold poisoning, one of the fastest, easiest tests people recommend is a vision test to determine if you have mycotoxins in the system. Or if you think about how sometimes after you have a night of drinking or partying, you wake up in the morning and your vision is a little bit more blurry, this is your body adapting and starting to clear chemistry. So one of the things that we can look at is instead of looking at the eyes as a problem, we look at them as a flag and a signal to look deeper into the body. So like with this, like what aspects of vision care overall do you think most eye doctors are overlooking?
Yeah, and eyes are windows to the soul. And it's the only part of your brain, like you said, that you can see without things getting really messy. So, so much is overlooked because the functional skills, the ability to track and to converge and to make things clear and depth perception. Most doctors are not looking into these systems. And so the whole saying, test, don't guess, a lot of times it's, well, if things are blurry, like you mentioned, after a night of drinking, and that continues because maybe you're doing consistent drinking or you have some sort of inflammatory reaction systemically, vision is a huge piece to that healing journey. And yet you go to the doctor with a chief complaint of stuff's fuzzy. I can't see clearly far away or up close. And then here's a pair of glasses, and that makes things clear. And then all of a sudden that becomes your new normal. Then you adapt to those. You need something stronger to maintain the same clarity. People don't recognize this, but glasses prescriptions for adults should not change year to year unless there's a functional problem causing those adaptations. And typically it's a near problem with a blur in the distance as the symptom, because let's say those focusing muscles can't maintain flexibility or disengage. And then we're driving the symptom by making things clear with new lenses. And all of a sudden we go down this vicious cycle. So, crutches and Band-Aids sometimes are needed for many aspects of healthcare, but also if you address the root cause, if you figure out why things are blurry when you're on the screen versus they're not when you're driving, or any other combination of decreased quality of how we see, there's always a reason, but you got to look, you got to know what to test for. So everyone should try and really seek out functional eye doctors or developmental optometrists or neuro-optometrists or doctors who are looking at the person behind the eyes, not just the eyeballs.
Yes, I love that, especially since they're such an extension of the nervous system. And I know, like, you had just mentioned kind of like how screens can be overwhelming to our body and stuff. Like, how can certain eye exercises actually help with the concept of reducing overwhelm? How does this overwhelm affect us? And any examples that you want to share? And then in that, how can we, or like, what's your opinion on things like when people use an eye patch to start to redirect their vision or any of those other approaches?
Man, so much to unpack here. All right, so under stress, the autonomic nervous system goes into the fight or flight response. And what that looks like from a vision standpoint is that our pupils widen and we get this tunnel vision effect. So we become really central in terms of our processing. We've got these two pathways in our brain that respond to information. And to really simplify this, one that responds to central focal information, one that responds to peripheral ambient information. In a normal, healthy brain, in the absence of stress, we're using these together so that I can look at my camera in front of me and I can see the door and everything around me without changing my eye movements to take in the world. So we can take in more with less effort. But under stress, like we said, because we become more tunnel vision-y, think about what happens when we're on a screen, when we're locking in right here. I mean, screen time has become the new pandemic. And in America, the average American spends 7 hours and 4 minutes a day on a screen. That's average, which means many
Multiply
people.
that by 50 years, that's a lot of life.
And so we know that's having a devastating impact on social development, emotional development, cognitive development, but of course, vision development. And from a vision standpoint, that's causing dry eye, it's causing eye strain, it's causing environmentally induced nearsightedness, where far away becomes blurry because of too much near visual stress on screens. And the data now shows that in the US today, 43% of America is nearsighted. Back when we landed on the moon, it was about a quarter of America. And it's estimated that by 2050, 50% of the world will be nearsighted. And that's including countries that don't even have access to technology like we do. The reason for that is near visual stress, too much screen time, and not enough time outdoors, where we actually have data and research to show what is needed to slow down this progression or what we don't want to do to speed up the progression. So, I think that's a big piece. Dryness. The average person blinks 15 times a minute. When we look at a screen, it goes to 3 to 5 times a minute, which literally means you're blinking less. You're getting a fresh, clean tear film on the front surface less. The windshield wipers are going across the windshield less. The brain then sends a signal to release more tears. Your tears get produced in the wrong consistency. Inflammation occurs. And then we all know the story here. Inflammation is the root cause of so much distress. Yet, if we're remembering to blink, if we're taking the right supplements, if we're lubricating the front surface, if we're looking away from screens, if we're having balance, there's so much we can all do to at least have better visual hygiene and have vision not interfere. You brought up not eye patches, and for something like a lazy eye or an eye turn, the old school treatment that many doctors still prescribe is an eye patch, where there's a good eye and there's a bad eye, so let's cover up the good eye so the bad eye has to work. Yet we now have data and research to support what my profession has known forever, in that amblyopia or lazy eye is a 2-eye problem showing up on one side. So unless it's addressed on a 2-eye basis, unless we learn how to get that eye that's not engaged to become more engaged in the presence of both eyes, then patching often takes a fragile eye coordination system and actually makes it worse. And even though eyesight may improve from patching, eye coordination often gets worse. And so really the most advanced treatments are tapping into what we know about neuroplasticity, that any brain at any age can be rewired. And that, even though a lot of doctors will say that after age 8, that's not true for vision, that's completely false. That's for vision lost, not for vision gained. So Dr. Smith, if you and I were to cover up an eye for 6 months with an eye patch, we take off the eye patch, things would be a little bit light sensitive, but we wouldn't lose eyesight. If you take a 6-year-old and do that for 6 months, you take away the eye patch, literally eyesight will have deteriorated because of back here. The visual centers in the occipital lobe that develop through our life experiences, that we don't have depth perception when we're born. We don't have the cells to allow us to see in 3D when we're born. So because they're learned, they can be learned well, not learned as well as they could be, and that's when some intervention is needed. But for vision gains, any brain at any age can develop depth perception. And we have right now a 92-year-old developing depth perception for the first time. So we're a little more malleable the younger we are. The brains are a little more like sponges when we're really young, but absolutely any brain can be taught new tricks, especially from a vision perspective. So hopefully I've answered some of that.
No, that was beautiful. And I love how you're kind of talking about the different components of vision, because for anybody who doesn't know, like the way that our vision works is because of our optic nerve, your visual field actually has like a black hole in the middle because your retina can't interpret that because the nerve goes through. Your brain fills in that hole. So your brain actually creates a visual field that's not even there for you. And that's why this stuff can be so powerful. So yeah, I'd love to hear any of your thoughts on that, and just especially like we did a really cool talk previously with like athletes and how they can optimize their workout. So for anybody wanting to learn more about this, definitely check out one of our earlier talks. But I'd love if you could maybe even use athletes as an example in the retraining that we can do for the eye movements, but also for the optic center of the brain.
Yeah. So we're all told to keep our eyes on the ball, right? But none of us are really shown or taught how to. And what we do is teach the how. So most of our patients are obviously with us because they have problems, because they have an eye turn or lazy eye or eye strain or headaches or trouble reading or trouble focusing or depth perception issues. But we also work with a ton of people for optimization and for enhancement and for anti-aging and longevity. And one of the coolest things I do is I work with professional teams to help them identify who to draft or take as a free agent based off of where vision is functioning, where it should be, and when there's a gap, send them to us. We'll close the gap and you'll get a much bigger return on the investment. So eye exercises are getting a lot more attention these days because vision problems are everywhere. And now many non-doctors are even offering eye exercises and what they're calling vision therapy because the need is so high. So a lot of OTs and PTs and speech therapists and teachers and parents, and I think for many people there's a lot of help provided there because the work is often the tracking system, which is kind of the x-axis here, which can provide a lot of help, but really life takes place on the z-axis, which is our convergence, our eye coordination, and our focusing systems. So, people who say eye exercises don't work, let's say, that's kind of like saying, well, exercises for your body don't work. Well, yeah, I mean, if you take a 9-pound dumbbell and that's all you have and you try and get really creative with it, you're probably not going to get into great shape. So ideally, you're going to the gym, you're working with a trainer, you're benefiting from cardio and strength and flexibility and all the different areas so that we can get kind of a cross-training approach. So from a vision standpoint, what that looks like is a nice mix of high-tech and low-tech learning so that we can apply what we're learning to three-dimensional space. So we heavily use augmented reality, virtual reality, eye tracking computers, but also really low-tech stuff like wearing goofy glasses where one eye can see the picture of a clown, the other eye can see the picture of the hat. And we're manipulating the clown and the hat so that the person has to adjust their eyes to maintain a single clear image. And then maybe we're asking them to keep it as they're walking forwards and backwards, or it's projected on an overhead or out a window. We're integrating thinking and movement and balance and the vestibular system, all the systems that obviously rely on vision in life to be on the same page. And so, there's certain eye exercises that I think are great for everybody to do that help develop better focus stamina or convergence ability or can help decrease motion sickness. And we can talk about any of these. But really, a well-rounded approach that is under the guidance of somebody who knows what they're doing is really key. And then repetition and the more muscle memory that develops, the more habitual it becomes, the more the maladaptation or bad habits are removed as options, the more this becomes a part of you. And so with enough work, just like the amazing work that you do with body manipulation, we can get to a place where we don't need to do this all the time, but if we're still pushing that trigger, if we're still on the screen for 10 hours a day, or if somebody's still doing CrossFit 30 days in a row without taking a break for rest, their body's gonna compensate. And so I think how we function, how we use our different sensory systems, there's huge parallels with vision workouts and then normal workouts where it works. You just got to be doing the right work and in the right place for the right reasons.
Absolutely. And I think and I also had a couple questions come in, so let me just make sure to address those. So someone had asked, can this be helpful for glaucoma and eye pressure? And then somebody else asked, would you say that photobiomodulation is a good way to reverse the signs of macular degeneration? So yeah, let's maybe take like a little pivot around how this can help the traditional eye diseases that we think of?
Yeah, so and I love your audience because it's always outside the box, and that's where I operate and play. So both of those are, medical problems, structural problems, and structure and function need to have a healthy, happy marriage. So for glaucoma, let's say, that's the optic nerve, which is the cable that sends signals from the eyes to the back of the brain. And often with glaucoma, the pressure is too high, and so it squeezes the optic nerve and it causes damage sometimes to the periphery. Or alternatively, the pressure is fine, but just, there's damage occurring because the pressure is higher than it should be. So for glaucoma, there's a lot of studies out about really high levels of certain supplements being very effective and very helpful. But any medical doctor would say that with glaucoma, there's nothing you do to improve it. It's just you're slowing down the problems and you're slowing down the damage. And I think from a reactive model, that's true. But from a functional medicine model, and I would be happy to share this with anybody. I don't know if we want to be given advice on what supplements to take at high doses, but there is really, really cool information about high levels of antioxidants and, how we can scavenge free radicals to help prevent the areas of our body, but specifically our eyes, from attacking itself, to slow a lot of that down. Photobiomodulation or red light therapy is kind of the wave of the future. We have mitochondria more in our eyes that require more energy than anywhere in our body. And light can do wonders for stimulating different areas of healing, but specifically through the eyes, we do something called syntonics or optometric phototherapy, where we have different protocols for different problems where they're patients looking at a specific light with a certain wavelength of light, or going outside and wearing one of different glasses like these that have different colors that it's allowed. So for somebody who, let's say, has trouble, with parasympathetic tone, there's a certain wavelength that we would have them wear in glasses, and literally you're hanging out outside for 20 minutes getting UV light through the filter, so your brain is filtering and processing information differently. Or, children or adults on the autism spectrum. I mean, I can count multiple times patients who have used language for the first time while looking in one of our syntonics machines and having areas of their brain stimulated that were not being activated previously. I mean, that's nuts. So
That's pretty
light
profound
therapy.
right there. Yeah, for anyone listening, like he's talking about what are considered neurodevelopmental issues, but really it's a part of the brain not being stimulated correctly, and we can actually work on these things. So that's a pretty big deal.
And I think for red light therapy, I mean, great for anti-aging, great for powering up our mitochondria, and specifically for the eyes. I mean, there's wonderful protocols in place, and we have some of our own at My Vision First that we can always share, and especially if we're working with somebody. But there's so much we can do better when we know better, especially from a longevity standpoint. And biohacking your vision, I'm turning into a thing now, and so exciting in terms of what we can do with that, because the glass is getting stronger every year. The needing reading glasses and your arms aren't being long enough. Again, we can push that down the road way, way longer, and we can even reverse it in many cases. But you got to do the work, you got to have the right intention, and you got to know what to do.
Yes, absolutely. And I just want to address a few other things that came in, and then we'll go to our next question. But someone said, can yoga inversion poses raise your ocular pressure and be harmful? My thought on that is that our body should be able to adapt to that. So if you're having issues with it, it may mean that there's a tissue integrity problem that needs to be investigated in the body through functional medicine in some way, and seeing why you're unable to adapt to that. And then someone also said, could this possibly help with acquired upbeat nystagmus? So I'd love to hear your opinion on those.
Yeah, so with yoga poses, I mean, I do think there are temporary changes in eye pressure, but they're temporary. And just like you said so eloquently, if the filtration system, if the tissue, if everything is where it needs to be and equilibrium is being maintained the way that it should be, that should not cause problems. But just like when you're in an inverted pose and all the blood is going to your head and your head is all red, I mean, if you're in an inverted pose for too long, that's not good. So probably also not good for the eyes. What was the second question you
Someone
asked?
asked about, can this help with acquired nystagmus?
Yes. So nystagmus is essentially the oscillating of the eyes. And very often it's because fixation or the ability to hold the line of sight, the laser beam representing where each eye is pointing, for whatever reason, isn't able to stay on one target. And so the brain is setting the signal of the eyes to try harder, and then all the muscles around the eyes are being innervated. And so there's kind of like this shaking, kind of like if we gave you a really heavy dumbbell to lift, you could lift it, but then the muscle starts quivering. So nystagmus is one of the clearest outward signs of neuronal or brain connectivity problems. And oftentimes with seizures or with epilepsy, I mean, when the eyes start changing how they're moving, that's a clear sign, okay, we're about to have one, or something is allowing for this hyperactivity. There's not a whole lot of research out there about nystagmus being improved with anything. And I would say in office-based vision therapy could not be farther from the truth. And we can do so much to allow the brain to use the eyes more efficiently. And almost so many types of nystagmus have something called a null point, or a position where actually the eyes can focus and point and work better together than in other positions. And we can take that position and expand it. Anytime there's nystagmus, we always want to rule out pathology and disease and the bad stuff. But so often that's just and like I said, an outward manifestation of what's occurring up here, and the brain freaking out and not using the eyes as efficiently as it's supposed to.
Beautiful. Beautifully said. And someone had asked, and I know we talked about it a little bit earlier, but there's a couple ways this can show up. Can this help blurry vision? And the answer is essentially yes, but I'd love to hear your opinion on
Yeah.
that.
So blurry vision, most doctors would say blurry vision is from the cornea, the front surface, and that often can happen. And like you mentioned before, with inflammation, or if you had too much sugar or hung over from the night before, the cornea can swell and that can make things blurry. But I would say in every case of blurry vision, it has to do with the focusing muscles. So the muscles behind the eyes are responsible for clarity. So if everybody could kind of squeeze their fists real hard for a few seconds, you'll realize after like 5 seconds, your hand starts to hurt. Yet if you were to let go and do this, you could probably squeeze your fists for hours cumulatively. When we are engaged with a screen, the pupil, which is the black hole in the middle of the eye, and the focusing muscles behind the pupil get smaller because the focusing muscles are locked in. But those are sphincter muscles, they're circular, which means when they're locked in here for too long, or for 7 hours and 4 minutes plus, which is average for a person in the day, it's literally clenching and constricting that muscle that's not meant to be locked in up close with all the brightness and blue light and glare and very unique eye movements that come with a screen. I mean, evolutionarily, our visual system is to guide movement and to scan the horizon so that we can be prepared for the saber-tooth tiger that's coming at us. But now we're making these very careful, intricate eye movements on screens, high energy, short wavelength, lots of contrast, and it's causing significant problems with mood regulation, with hormonal regulation, and everyone's heard about blue light these days. I mean, blue light is actually essential for us, but natural blue light for hormone balance, for sleep regularity, for even just mood. But blue light that's artificial, that's harmful, that's blasting our brain all days long, that can really do damage to so many aspects of health, but specifically because of the cells in the back of our eye, the photoreceptors, whose sole job is to signal the sleep-wake signaling to let our brain know when to secrete those hormones. If they're constantly firing, your brain's not going to be functioning and releasing hormones the way they would otherwise. So we could talk a lot about all of that, but the blurry vision so often is the muscles up close being clenched and stimulated for too long, and then having difficulty maintaining flexibility, and being locked in for too long, so that far away gets blurry because of the near problem, or up close gets blurry. And again, if we can develop stamina, flexibility, and efficiency with that system, almost every blurry vision can be significantly improved or eliminated to the point where it doesn't happen. Yet that's a functional approach. And so something like screen fit or office-based vision therapy to address, to identify the root problem and the root cause. Well, if you tackle that, then the symptom doesn't happen.
Yep, absolutely. And for anyone, just for like a simple exercise, like when I'm in my office, I look at the computer, I look at screens a good amount. I try really hard to look out the window and like look at a tree and try to make out as many leaves on that tree as I can. And it's just something I do regularly throughout my day, at least a number of times, for exactly the reason he's talking about, of getting the dynamism in the muscles and in the function. And then we also mentioned earlier, because I saw another question come in around, can this be tied to things like parasites? Like, yeah, definitely. It can absolutely be tied to toxin exposure and gut health and all of that. And that's kind of what we were talking about in the beginning. But let's dive more into the screen stuff that you're talking about, because I know you kind of think of it as like a new pandemic for the world. But you have a whole program around helping people to retrain. Like, what is it that you focus on in that program?
Yes. So, well, first of all, I want to real quick just talk about what you do looking out the window is massively important. And a lot of people have heard about this 20-20-20 rule. What that means is never more than 20 minutes on a screen or on a near anything without looking away 20 feet away for at least 20 seconds. So you're letting the muscles, the brain, everything disengage, come back. And what you're doing with intentionally placing your focus in the distance, I mean, we could do everyone should start a near far focus activity today, which is literally, and this is as simple as it gets. Cover up an eye with one hand, take a pen or pencil, even your finger, bring as close to you as you can so it gets a little blurry. Stop, try and make it clear. Feel the muscle locking in, feel the pad of the finger becoming clear, that you're looking hard at it. Hold it for 5 seconds, then throw your focus out the window or into the distance for 5 seconds, and then back at this for 5 seconds and the distance. So you're basically constricting, relaxing, doing push-ups with your focusing muscles. Do it same amount of time, right eye, left eye. You'll notice your fingers or the pens are going to be different places. The more you do that, the closer it will get. That's kind of like saying do sit-ups. Like sit-ups are helpful. And if you do a gazillion of them, like maybe you get a six-pack, but also you got to figure out functional movements, nutrition, all the other things to attach those goals. And what you mentioned about screen time. I mean, I am not anti-technology, and I heavily use technology in my office to further our profession and to deliver elite level of care for our patients. And technology is not going anywhere. So we have to develop the foundation in place to thrive in this world, which almost anybody can do, but it requires extra work and extra training. And if you think about how digital devices are now everywhere and they're taking up shopping, going to the grocery store, dating, even reaching out to your next door neighbor to get an egg, let's say, that's how we're all communicating here. So we have this program called ScreenFit, which literally is a at-home workout program that is revolutionary for this space and for pretty much everyone who is engaging with screens, because it's at-home visual training exercises to reduce symptoms, promote healthy habits, but really to change how somebody's using their vision to establish that foundation. So there's a lot of work on ocular motor control and tracking. There's a lot on eye coordination and convergence. There's focusing, stamina, flexibility. There's even a lot of movement-based activities. You don't need any equipment. It is on a screen, but it's a video. Each lesson has a video of me talking with the patient, going through what to do, and then you put the phone down and then you do the lesson. And all of these lessons can be done, for the most part, like at a stoplight, in the bathroom, in between, calls for work. And the goal is that these become a part of you and you're more intentional and proactive with the work that you're doing. We've had as young as 5 and as old as 89 go through this successfully, with 100% of people who've gone through this seeing a reduction in symptoms, which is crazy to think about. So this is now becoming a corporate wellness program for a lot of companies. Marriott's offering it to its employees, work for a government contract. This is just giving vision a seat at the medical table. And it's so great to be able to recognize you can do stuff today to use your eyes to rewire your brain so that you can handle screens more easily. And if it moves the needle enough, awesome. Just like you exercise your body, you can exercise your eyes from now on. And if it helps some, but not enough, then that's when a little bit more aggressive intervention is needed. But these hidden functional vision problems are everywhere until you know what to look for, and then they are right in front of your face because so many aspects of what we do for life we just take for granted.
And I just want to reiterate for everybody that he said 100% of people have an improvement in their vision after doing it. So that's pretty cool. I want to ask, how many people have you helped either change or get rid of their glasses?
Great question. So we recently did some calculations. I've been doing this for 15 years. We have tens of thousands of patients that have seen life-altering improvements, specifically for glasses. Prescription slowing down or stopping, I would say, is probably 99% of people we work with, where if things are out of whack, I mean, the people that come in with a shopping bag full of glasses and are saying, none of these glasses work. Well, it's not the glasses, it's the brain behind the glasses. We can almost always slow down and stop the progression. In most cases, even reverse it. I haven't counted, but in the triple digits for sure, people who literally went from glasses and are no longer wearing them anymore because the need has gone away because they can do that much more functionally. And I'm a big believer that we should be 20 happy rather than 20/20. So the ideal prescription is the weakest lens possible that gives the most improvement, that's the most balance between each eye, that improves performance. So you should be making the decision with your eye doctors on what the next glasses prescription is going to be, if a change. And if there's a change, there better be a good reason why. But we all don't have to see the same. We all don't have to see HD at every distance. And so having vision guide and lead, and having eyesight and vision be in that healthy marriage, that's when life gets good.
Well, and I'm a big fan of letting the body do what it's designed to do, even if it's a little bit of a challenge. It's like, yes, we all need to be helped along, but at the same time, like, I might, use a brace for somebody who has a musculoskeletal injury for a little while, but I certainly don't use it for their entire life. Otherwise, that muscle is not going to perform as well anymore, and the body will adapt to that. The body is incredibly adaptive. I know you had mentioned something earlier, and I just want to touch back on it because I think a lot of people struggle with it and just think it's a lifelong thing. How does this all tie into motion sickness and how that can improve for people?
So I would say 85-ish% of motion sickness has a visual component that's improvable and in most cases treatable. So we talked a while ago about the central and the peripheral visual processing pathways. Somebody who prefers to drive but doesn't want to be in a passenger in the back seat because they get motion sick, or they pull up their phone or tablet and that makes motion sickness worse. That is almost diagnostic for this is vision and this is treatable. And what happens is the brain and the body gets into this disequilibrium, or this freak out phase, where central eye movements and information in front of us are giving us the signals that we're not moving, we're static. But then our vestibular system, our internal GPS system in the roadmap of life, is letting us know that we're in motion. And vision is then getting all this optic flow of motion. And then the brain doesn't recognize which system to process with, and it goes into this disconnect. So much of motion sickness has to do with obviously allowing these systems to be in synergy, but from a training standpoint, to be able to access central and peripheral information simultaneously, and to be able to actively engage periphery and open up periphery. I mean, so often, driving over a bridge can elicit all this anxiety, or fear of heights, or hesitancy with curbs. I mean, if we're not able to navigate through space appropriately, if we're not able to trust what vision is providing our brain, if we're not trusting what we're seeing, then of course the emotions and mental health become involved. And so there's so much that can be done to actively learn how to counter some of this. And when we go down this kind of tunnel vision spiral, to be able to pull out and say, whoa, I'm okay, I'm safe, and here's techniques and strategies I've learned visually to come out of that, but also you can get to a place where that doesn't happen. So motion sickness, I mean, so many kids now are motion sick. Parents are giving them tablets and phones and books. We should be looking out the window. We should be talking. We should be developing these systems that when we're born are not in place. And so the child who's exposed to screens and technology, as an infant, we don't have the foundation to handle that. And yet that's why functional vision problems are increasing at a ridiculously high rate, because when we were kids, we didn't have screens till we were much older. And now kids are even being asked to read in kindergarten before they're visually ready. So when that occurs, that's when these symptoms emerge, and that's when these problems occur.
Ooh, I love that you just said that. So I'm going to touch on one thing and then let's dive back into
Yeah.
that. So I even had an experience where my body was just stuck in kind of a high stress state for a long time because my nervous system just didn't know how to do anything else. And then I basically did some nervous system physical therapy. And the first thing that happened after my first appointment, the first thing I noticed is I went outside, my field of vision was twice as wide. I had a whole completely different field of vision just from someone doing some body work and shifting my nervous
And
system. So
opening up.
yes, exactly, opening up that peripheral vision. So I think that's a huge deal, especially with how much stress we deal with nowadays. And and for anyone wondering how blue light affects us, like the reason it's beneficial, natural blue light is like the sun in the morning, right? Like the really bright sun. It stimulates your cortisol. It stimulates your cortisol rhythm. It gets you going. It gets your energy up for the day, which is why it makes you not sleep well at night because it stimulates your cortisol. And then if you do it all the time, it's constantly stimulated. And then if you have constantly stimulated cortisol, it can affect all the other systems in your body. But that's just one comment I wanted to make. Coming back to what you're talking about with the kiddos, like let's just go full circle as we kind of start to wrap things up here and come back to childhood and the things you really want people to know. What about things like dyslexia? Because you just mentioned that kids were being forced to read too early and that's a thing. And like, let's talk about before accepting the long-term diagnosis of a child, what should we be looking into that you wish everybody knew?
Thank you for bringing up the D word. So dyslexia by definition means difficulty reading words. 95% of the people I work with have difficulty reading words, but because of functional vision problems that are influencing their ability to scan, focus, track, and process information across a page. And, I had a conversation with a parent yesterday. I said, it's not like your son was born just like missing a portion of their brain. It's, oh, this is the portion for reading, and he doesn't have that, so I'm sorry. Diagnoses in general can limit us and can completely change so many windows that we want, doors we want to have open in life. Diagnoses also are temporary endpoints and can often be eliminated with the right work. So dyslexia, again, is an incomplete diagnosis unless functional vision problems are ruled out first. And so often it has to do with the visual centers and the auditory processing centers and the language centers not communicating efficiently. And we can literally tap into different neuronal networks, that either ones that we have and we're bypassing or creating new ones to develop the foundation for reading. I mean, the fact that dyslexia diagnoses are increasing at such an alarming rate, again, that's not our brains being born without these little portions that should be there. It's literally your brain being a Swiss cheese and you're not having certain areas communicate, and we need to be able to fill in those holes. So I think for somebody who thinks they are dyslexic or is told they're dyslexic, I would strongly argue and say that if you have difficulty keeping your place, skipping words, skipping lines, words going in and out of focus, become blurry, your eyes hurt, your head hurts, you can't remember what you're reading, you're having to reread, you're holding things too close, you're tilting your head, you're covering an eye, those are all signs very clearly that diagnosis cannot be applied yet. And it's how your brain is using your eyes, which can be taught and trained for any brain at any age.
Yes.
And then in kindergarten, when we have teachers and certain school systems saying, why are you not reading chapter books? Most kids aren't visually ready. And I'm a big believer that developmental milestones from a vision standpoint are in place for a reason, so we can continue to build from a foundation that is becoming more fine-tuned. But similarly to how now many people are saying that crawling isn't a developmental milestone, and you just go right to walking. Kids who skip over crawling, from a vision standpoint, much more likely to have an eye turn or lazy eye, because that's the crucial time to learn how to use both sides of the body, develop the core stability, to have the world go from static to all of a sudden dynamic.
It connects the hemispheres of your brain.
Thank you.
Yep.
Well,
And
that's a good thing to have connected, right?
Yes, everything that you're talking about, like it's such a big deal, and vision is a piece of it. But like one of the things that I do that was part of my perinatal pediatric training for just moms and kiddos is checking primitive reflexes.
Yes.
Most doctors learn this in school, like it was part of board exams, but they just don't apply it. And whenever I have a kid come in, that's part of my exam, I'm checking primitive reflexes. If I have adults that get head injuries, I check for primitive reflexes. And what that is they're reflexes that are supposed to disappear at a certain developmental stage. But we can
When the
retain.
need goes away, right?
Yes, exactly. And we can retain them over time, and then it can really disrupt our neurology. So that kiddo that cannot sit still in his chair, and every time his back touches the chair, he wiggles, that can be a gallant reflex. It can be something that's retained, or every time his spine is touched, the muscles spasm. And then all of a sudden he's diagnosed with ADD and put on Ritalin. So just like keep in mind that these neurological things can happen, and it's really worth asking someone about this stuff, which is why I even brought it up, because a lot of people have never heard of it.
Yeah.
So I love that you're bringing this into awareness that, like, yeah, there's actually developmental stages where we're supposed to do reading. So just so people know, like, what do you think is the proper developmental progress for that?
When that child you just described, who seems like they have ants in their pants in the classroom, they're probably relying on their ears to take in what the teacher's presenting because they can't with their eyes. And so it looks like they're not paying attention, yet they're just not using their dominant sensory system of vision. They're relying on auditory to take in the world. And, that's somebody who wants to be read to from their parents and can remember everything when they're being read to, but when they read on their own, it's like no chance. That's a problem. The developmental milestones for kids. I mean, from a vision standpoint, screens should be introduced as late as possible. And there absolutely is a time and a place where you need your child quiet for a short period of time. I get it. I have 3 kids. I'm there as well. But, for up until age 2, the only time a screen should be introduced would be FaceTiming a loved one and high quality reasons. And ideally, it's the biggest screen, the farthest away, the better. So hold the phone up, but then mirror it onto the screen so they can see grandma on this big TV that's far away from them as possible. As we get older, I mean, the American Academy of Pediatrics has limitations on screen time. I always say everything in moderation, and we need to be balancing the same amount of time we're spending on screens with at least that much time, if not double that amount of time outdoors, and being able to really explore with our distance vision and explore with our visualization and do the stuff that kids used to do where they're looking into the clouds and they're developing the visual cognition to visualize and to see things in their mind's eye, which so many kids don't even know are possible now. Milestones, though, I mean, one of the most common ones that we see is even following a target across our midline, this whole head and body and everything moving and not able to dissociate eye movements from head movements. So relying on the gross motor muscles of the body for what the careful, small eye movements of the eyes can't do on their own. By 7.5, we should be able to smoothly track with our eyes without moving our body. Convergence, by 6 months old, we should be able to converge to our nose as we're putting food in our mouth and watching it as it comes in, and getting close to mom and to dad and to caregivers as just normal life-sustaining needs are being met. But a child who is neglected, or I saw somebody earlier this week who was adopted at age 3 from an orphanage where they literally were in the same crib up until 3 on the same side, and the side facing the mattress has very deep, massive amblyopia. It hasn't developed the ability to see. And something as simple as like putting that child on the other side or moving the crib around or having some human interaction, that's how we develop something like visual memory, to know that mom's face is the same face as this person walking in because I'm seeing it in repeated exposures and in novel scenarios, and I can assign the face to who that is. Or learning sight words and letters and numbers, that's usually a labeling problem with language to the symbol. But if our brain is like an Etch-a-Sketch, and every time we see the letter A, it's like, I don't know what that is, there's no meaning to that, then you're not gonna be able to say that's an A. But if there's some sort of meaning to it, if we're able to then string these together and have meaningful life experiences and learning takes place, then letters to sight words to sentences, sentences into chapter books become something that is built upon and doable.
Absolutely. And I think about just all the different ways that our eyes map, right? And it really maps with triangulation in the face. So one of the things that I've seen with kiddos in office is some neurological changes since we all spent a lot of time with half of our face covered. and all of a sudden
Yes.
they couldn't interpret things and they
Yes.
couldn't interpret social interactions in the same way. So I actually think we'll still be seeing some developmental things from that time period as the years go on. So man, we could talk about this all day. I love this. Someone had also asked, is like a general preschool screen enough for this? I responded, probably not comprehensive enough, but where would you direct people if they wanted to learn more about this work, or if they wanted to get that kind of evaluation done? Like, what would be your
Yeah.
recommendations for them?
So the international organization that board certifies doctors in vision therapy and in functional vision is called COVD, and they have a new branding, but right now the website is covd.org, and you can type in your address, covd.org. You can type in your address, and it'll give you a search radius of doctors who know more about this than those who don't. And you want to check the box that says ideally that they're board certified in vision therapy, which means there's a very different level of understanding. But I think from an evaluation standpoint, there's less of a gap. From a training and treatment standpoint, there's a massive gap. And it's because something like physical therapy, where for a sprained MCL, grade 1 is a dozen sessions, grade 2 is 2 dozen, grade 3 is 3 dozen, there's kind of consistency across the board. For vision therapy, there's not consistency yet on what that looks like. And so, a lot of people can say, I did vision therapy and it didn't work. Well, if you're in the right place and you're for the right reason, it works, but that's not always the case. And so, number one, from a screening standpoint, this should be as early as 6 months old screened, and every year thereafter, and for sure before kindergarten, make sure they've got the visual foundation, the visual readiness to handle what's coming. And then, what the treatment looks like. I mean, I would always, like with anything, ask about options, ask about positives and negatives with every option. And very often lenses or prism or filters are the only option available because there's so few of us who do this and have this expertise. And, as long as you are making decisions with the practitioner and they're treating you or your child as if it was their child or their loved one, then you're going to be in good hands. But really, a neuro-optometrist, a developmental optometrist, or somebody who has this understanding of function on top of the understanding of structure, that's really the game changer here. And then, with our practice, myvisionfirst.com, we have a ton of people come from out of state for these intensive programs where we do a week-long boot camp. We're doing an evaluation beginning of the week, an evaluation end of the week, like a dozen sessions of training. And then we have an individualized custom virtual reality program that we put every patient on, along with also a real robust home program for at least 3 months after, so that we can kind of continue to make strides and make progress. But for many, a week boot camp is the equivalent of like 3 to 4 months of treatment if you were across the street. So lots of options, lots of scenarios.
I was going to say, what kind of improvements have people had at your boot camps?
So this week we have 5 here. And we've had many patients at the end of the week read a menu without glasses on for adults or kids. One of the most exciting ones is a mutual friend of ours, and I won't say the name or anything else because of HIPAA, but their son came to us for therapy for a week, and by the end of the week was going through the airport, pointing out things without, honestly, a leash needed to keep him close to them.
So his behavior changed.
Behavior changed drastically. Looked at his dad's phone and says, "Oh, it says the time on there." And he says, "You didn't know you couldn't see the time is on my phone?" So I could never see that before. Or, even just so much less hyperactivity because vision is now tying together all the input from the world, and he feels safe in his space. And this same child went from not reading at the beginning of kindergarten to 99th percentile by the end of kindergarten. And the only thing we did was this boot camp to reroute development, to allow development to continue to function the way that it's supposed to, but without roadblocks in the way.
A 1-week boot camp. Wow. Okay.
I mean,
this is awesome.
We've fixed eye turns in a week. I mean, often severe cases need more than a week, but we have patients who come back for 3, 4, 10 weeks. It's obviously a lot easier if we're across the street and we can make this part of life. But my problems as a kid took 3.5 years to accomplish, to fix. And for my same profile, we can do that in a matter of months now for what took years before, just because we have that much better understanding of the neurology, but also access to virtual reality, augmented reality, eye tracking computers, the ability to do some of this from home, programs like ScreenFit to help continue to move the ball down the court the way that it needs to. So the first thing is just making sure we've ruled out this as an option. And then the paths and to get there, there's so many options in terms of what can be done to facilitate the appropriate development and opening up of a vision for life.
Amazing. Thank you so much for taking the time to do this today. This was great. We covered so many things. I'll definitely be sharing this with a number of clients. And for anyone listening, if they wanted to reach out or work with you, where would you send them?
My pleasure being here, and I love every conversation we have together. And it's so fascinating, your perspective on the body, and I want to do much more of this so that we can help our patients from all your expertise. Best way to contact us, My Vision First is our website, our practice website, and we actually have some really cool things about to be launched. We have digital performance lenses, so lenses that anyone can wear on screens from a protective standpoint, with a consult involved that allows us to know what the lenses should be, the right filter, the right prescription. We have a customized, first of its kind vision support supplement coming out, without saying too much more, that is in gummy form and is nuts. We have this individualized, customized home VR program with testing protocols that actually somebody can just buy a headset, put the software on, and that can start to move them in the right direction. But then ScreenFit as well. ScreenFit.com is a wonderful resource. Or like we're talking here on Instagram. This is the best way to kind of, God, this resonates with me, this was me, or this is my kid. And I've just gotten really comfortable going outside my comfort zone, just raising awareness. And I think that's so needed. And then really exciting, we've got a TEDx talk coming end of the year that is going to be massive for our profession.
I mean, hey, someone said earlier in the chat, you're a pioneer, and I full-heartedly agree with that. So keep up.
So
No, it's true. Like, this is exactly what we need in our healthcare system, is people thinking outside the box instead of just not even knowing that they're in a box. So thank you so much for doing this. And yeah, for anyone curious, feel free to comment, ask questions. This will be recorded and posted on my feed. I'll mark him as a collaborator, so it's on his feed as well. Ask us questions in the comments. We can always do another one on more advanced topics, whatever you want to know. If you need to reach out, feel free to reach out through Instagram or going to his website, myvisionfirst.com. And if you need any functional medicine help, always feel free to reach out to me. And thank you so much for everything. And yeah, I hope you have a wonderful day.
Such an honor to be here. So grateful for this connection, and you as well. Great to see you.
You too. Bye.
Bye.